Today I am going to talk about the bladder dysfunction. So the bladder dysfunction is a serious medical condition which is caused after the spinal cord injury. So one urinary tract infection is one of the most common cause for the mortality and morbidity in the people. So the spinal cord injury alters the complex reflexive and voluntary control of the micturition. So that's why the most of the people require catheter to drain the urinary bladder. So, first of all, the spinal cord control for the maturation is originate from the sacral segment S2, S3 and S4. So, the level of spinal cord injury detects the level and the type of bladder dysfunction the person can have. So, if the injury or the spinal cord injury is above the conus medullaris or the sacral segment, it develops a spastic, a UMN, and a hyperreflexive bladder, or also known as a bladder, which is unable to store the urine. And if the lesion is occurs below the sacral segment or in the sacral segment or in the conus medullaris, it causes a flaccid or reflexive bladder or a bladder which is unable to uh, drain the urine. So this is why it called as a LMN bladder. So the bladder, it is mainly have the muscle known as a detrusor muscle which contracts in order to drain the urine. But in a spastic or hyperreflexive bladder, the contraction and reflexive empties in response to the certain level of filling pressure. So the reflex is intact, but the detrusor muscle is generally very hyperreflexive, which is a feature of the UMN lesion, and there is increased tone of the sphincter. So the detrusor muscle contracts, and even if there is a small urine volume in the bladder, it contracts and lead to the failure to store the urine. And there is no coordination between the detrusor and sphincter, lead to dyssynergia, which will the detrusor muscle will contract, but bladder will also contract, and they will be not able to drain the urine. But in a flaccid or a reflexive bladder, there is no reflex action of the detrusor muscle, that the bladder is unable to contract. So there will be no um, draining of the urine in that case. So there are two: the failure to store urine, which is a UMN bladder, and failure to empty the urine, which is LMN bladder. So the cause for the bladder dysfunction is mainly because of involvement of detrusor, or it is because of the sphincter impairment. So the inability to store the urine in as in UMN cause, it is due to the reflexive sphincter or the spastic detrusor muscle, or inability to empty the bladder as in LMN, it is due to the reflexive bladder, which means the reflexive detrusor muscle, and a sphincter which is not able to relax, that means it is a hypertonic sphincter. So the dyssynergia between the detrusor or sphincter lead to the incomplete drainage of the bladder, because in the dyssynergia the detrusor muscle will be contract, but if the sphincter is reflexive, then it will lead to the, or the sphincter will be tonic, that is sphincter also hypertonic, then it will lead to the incomplete drainage of the bladder. Or else, if the detrusor muscle is not contracting and the sphincter is reflexive, that means that it is also, it will lead to the incomplete drainage of the urine. Thank you.